When not performing surgery or seeing patients at Penn State Health, Dr. Brian Clark uses his time to stay fit. 3 years ago, while his physical appearance and stamina appeared healthy for a man in his early 50s, a few routine screenings revealed something wasn't right.
One of them was to get a prostate-specific antigen test, which is a PSA test, and that is a screening tool for prostate cancer. So up until that point, I was otherwise asymptomatic. I was living life and had no symptoms whatsoever.
The test came back with an elevated reading.
His initial PSA test came back in the 7 to 8 range. And PSA, just for reference, it's a protein and it's released by the prostate. So any man with a prostate will have a PSA level.
I was relatively young and otherwise healthy and did not expect it to be prostate cancer. But we repeated it, and on the repeat test, it was elevated again. And at that point, I met with Dr. Rahman.
So for a 50-year-old male, normal PSA is about 2.5 to 3. So Dr. Clark's value was about 2 to 3 times greater than what we would have expected.
A physical exam followed, and then an MRI.
The arrows and the marks show us that on the right side of the prostate, that he had multiple areas extending all the way from the base of the prostate to the apex of the prostate.
That was consistent with a mass in the prostate. So that was the day of diagnosis. And I remember that day, and we'll always remember that day.
It was a surprise, not just for him, but would be for any of us, that this could be brewing along even when he was physically feeling well.
Now that there was a diagnosis, talk turned to treatment.
We talked about surveillance, we talked about a surgical approach, robotic radical prostatectomy, as well as radiation therapy associated with a short course of hormones.
The shoe was on the other foot. I am a surgeon. I'm a heart surgeon for babies. I'm a pediatric cardiac surgeon, and I operate all the time and have for decades.
Dr. Clark chose a similar path. He opted for surgery.
That was the treatment that was the most likely to be associated with a cure and a long life following the treatment.
Then one surgeon handed the tools and trust over to his colleague.
I sheet a little bit further away from the prostate, leaving a little bit of tissue on the prostate as an insulation per se, to make sure that we achieve a negative margin, meaning no cancer that's penetrating through these tissues.
The same day after surgery in the evening, I was up and walking with my wife, walking the halls of the hospital, which is good for your recovery. So I went home the next day on a Saturday, and then the remainder of that week, we walked outside.
6 weeks later, his PSA levels dropped to an undetectable level. And now, 3 years after his diagnosis, he and his urologist are encouraging other men to keep up with their regular screenings.
This is really one of those great examples of why screening is so critical for this disease.
I had a silent prostate cancer that didn't just crop up. It had been there for a long time. And if I waited another year or 2 or 3, then it would have continued to progress, and I may not have had the same great result that I have had if I had waited.